everyone. Good morning, good afternoon, good evening. Welcome to Nostella's Corner from wherever you're watching me. Welcome to the home of Water Must Flow. As we all know, every January is International Cervical Cancer Awareness Month. And we tend to emphasize on things to do for you to detect cervical cancer early. We say once cervical cancer is detected early, it's preventable and treatable when you detect it very early. So please, I'm going to tell you the facts on cervical cancer. We all know that cervical cancer is abnormal growth of cells in the cervix, and the cervix serves as neck of the uterus or of the womb. It's an opening between the vagina and the uterus. So if you see abnormal cells growing there, it calls for query and you need to see your doctor very, very early, so that once all these facts I'm going to tell you is established, then you need to know the right thing to do. We say cervical cancer is preventable and treatable. That is when it's detected very, very early. And it's caused by human papilloma virus. That is the second fact. Regular screening is advisable. Pap smear and human papilloma virus testing, very, very important to help you detect cancerous cells very, very early so that you can be treated. Another fact is that human papilloma virus has a vaccine that you can take at early stage to prevent cervical cancer. So these are the facts. And another thing, early stage is often not, you don't really detect the signs, you don't really get the symptoms at the early stage. So you need to go for this screening. So when you go for screening, it will help you detect this and it will be treated in time. Then another thing, warning signs. We have warning signs of cervical cancer. Abnormal bleeding, taking longer period than expected. You also have pains, abdominal pain, lower abdominal pain and back pain. Then you also have unusual discharge. You start having some discharge that are offensive and they don't smell nice via the vagina, so you need to see your doctor. All these are warning signs. And painful, when you're having pains during intercourse, you need to check yourself. They are very, very important warning signs. When your period is becoming longer than the normal time, and then post-menopausal or premenopausal pains, when you start having pains, please see your doctor, because all these facts help you to detect cervical cancer in time and you treat it. It's very, very treatable when you detect it early. Then you have, all women are eligible to going for the screening. Please endeavor to go for this screening. As a woman, do a pap smear. Yes, it might be painful a bit because the procedure is sterile procedure and they need to expose the cervix by using a speculum to open up the cervix. locate this, to open up the vagina and locate the cervix. And there's a brush, a spatula they use to brush the tip to enable the healthcare professional carry out, as in pick the sample and keep in a sterile swab stick or a container and take it to the lab to carry out investigation. So please, every women are eligible to this pap smear. Early screening helps you to detect cervical cancer and to help you treat it in time. And you also know at Nostella's Corner, we will always emphasize on your health because your health remains your wealth. At Nostella's Corner, we will always give you wonderful advice to enable your health go on smoothly, for you to manage your health well and live a healthy life. And please, to prevent this, endeavor to go for your regular checkup. Watch your diet intake. Take good care of yourself. Healthy sex matters a lot. Take good care, wonderful care of your system. As a woman, your reproductive health matters a lot. Your personal hygiene matters a lot. Carry out pap smear. Get your vaccines. Once you're negative, please look for the next advice from your doctor. And make sure you are well educated about cervical cancer. It goes a long way. At Nostella's Corner, remember, water must flow. Your kidney must function well. Every of your vital organs must perform their normal functions. Thank you. Have a wonderful day. Bye.